Medications work in some individuals and cause adverse effects in others, and it can usually be traced back to differences in genetic makeup. Just like our genes determine everything else about us, they also play a vital role in determining how effective our body will be at processing different medications. Genetic testing helps us understand how a person's genes affect how they respond to medications, also known as pharmacogenomics or pharmacogenetics. Its goal is to help doctors select the medications and doses best suited for each person. There are two types of medications, active and inactive. Most medications are active and ready to work after you take them. When they go through the body, they are converted into inactive metabolites and excreted after doing their job. On the other hand, prodrugs are inactive or less active, and they need to be converted into different active chemicals before being able to work. Variations in genes affect the rate at which the body will process different medications. It can generally be categorized into 4 phenotypes. Normal metabolizers are individuals with fully functional enzyme activity. This means they process medication through their system at a normal rate, can use medication at standard doses, and only need to follow the usual precautions. Intermediate metabolizers are individuals with a combination of normal and decreased function genes and may have a slightly slower rate of processing a medication. This increases their risk of experiencing side effects at a standard dose. Poor metabolizers are individuals with a combination of no function or decreased function gene variations. They may be more likely to experience side effects if given a standard dose. In contrast, other gene variations can cause the body to process certain medications too quickly. These are found in rapid and ultra-rapid metabolizers. The same person can be a poor metabolizer of one medication and be an ultra-rapid metabolizer of another medication. Sometimes, you can have more than one gene impacting how the body processes medication. Each gene could have a different effect, meaning the response to the medication is likely to be unpredictable. Normal metabolizers are given a starting dose recommendation for active medications that need to metabolize to inactive metabolites. In intermediate metabolizers, therapy can usually be started with the standard starting dose. However, higher plasma concentrations may increase the probability of side effects, in which instance a reduced dose should be considered. For poor metabolizers, the recommendations are mostly to select an alternative medication not predominantly metabolized by the gene. Some genes will cause the body to process certain medications too slowly. This results in higher amounts of the medication in their system than expected. If the initial medication is, however, warranted and cannot be replaced with an alternative, then one needs to consider a reduction of the recommended starting dose due to the increased risk of side effects. Due to the risk of therapeutic failure in rapid and ultra-rapid metabolizers, alternative medication not predominantly metabolized by the increased gene function is usually recommended. In rapid metabolizers, the breakdown of the medication is too fast, which causes the medication to be processed through the body before it can provide adequate symptom relief, making it ineffective. An increase in the dose may also be needed. The general dosing recommendations for prodrugs that must be converted to their active metabolite are to avoid them in poor, intermediate, rapid, and ultra-rapid metabolizers. Poor and intermediate metabolizers may have poor medicine efficacy and are at risk of therapeutic failure when taking prodrugs at standard doses. On the other hand, rapid or ultra-rapid metabolizers will metabolize the prodrug at an accelerated rate. Often, this may still be effective, but there are risks of toxicity due to high levels of the medication in the body. While the personalized genetic results provide insight to help you find the best medications, your Intelligene test results are only one part of a complex puzzle. Other factors also contribute to treatment selection and individual response, including age, weight, diet, overall health, other medications, and much more. Intelligene would also like to remind you that the recommendations mentioned here are general guidelines and that you should never modify treatment on your own without consulting a medical doctor.